Hi folks, I'm Dr. Tom Meade. Welcome to part 2 of our special orthopedic show on sports medicine. I'm here with my co-host, Dr. Eric Lebby. We had a great first show. We can barely believe the time went that quickly, but we want to cover a bunch of different topics in our second show. We have 2 experts, Dr. Nick Slenker, Dr. Neal Stansbury. And so, Neal, I might get started with you. You know, you see athletes doing a lot of crazy things. I don't know, some work, some don't work. You see tennis players, they've got this tape all over them. They're putting themselves in ice baths. Now there's these the new business model of cryo centers, which is something completely different. But what's your thought on some of these techniques? What's the science behind it? Does it work?
So that's the ultimate question, right? So they're hyperbaric. Well, they're basically called cold plunges, if you will. That's what a lot of people are doing now. And basically, a cold plunge is basically defined as they don't like you to go lower than 53 degrees, but it's basically you go into a cold environment for maybe 5-10 minutes or so. If you go too cold, you can cause permanent damage to your skin. If you go too high, then you may not get the benefits. And the thoughts are that the benefits decrease inflammation, and there's some talk that it may improve the immune system, which has not been proven at all. But there is talk that it does help with recovery. You know, helps with the blood flow, helps calm the muscle injuries and tissues down a little bit, and allows you to get back a little bit quicker. So that's why the athletes are using that.
So, but when you see in the locker rooms, it has to be 33 degrees when they get in the ice baths.
So those are a little bit quicker. They don't go in those as long because otherwise they will cause some serious damage to their tissues. So
yes, how about this taping that you see? Does that help?
So that's the other one. All these things that are done, the cold plunge, the taping, all these things. When you actually look at the science and they look at all the studies and they go back and they say, okay, you know, 42 people have done studies on these things. Let's go back and look at all of this and does it actually work? And I think they're kind of oversold and they under deliver. And in other words, there may be some benefit to all these things, but to actually be able to quantify that and show that with a study has been very difficult because the benefits seem to be there and they seem to work a little bit, but they seem to be more minor than major.
Yeah, and when it's endorsed by a celebrity, it almost gives the thought that this is based in science and reality.
Well, the classic one for that is the copper bracelet, right?
Oh, yes.
I mean, we all looked at the copper bracelet. It was this huge thing for years and years, and everybody jumped on and put copper in and swore that it helped, and now you don't see them anymore. And why don't you see them anymore is because they actually didn't work. So.
And the magnets, remember the magnet bracelets?
And the magnets.
So.
Magnet bracelets. But, you know, speaking about, you know, one I remember that sticks to me is Terrell Owens when he had that high ankle sprain before the Super Bowl, the Eagles against the Patriots at the time. But remember, he did that hyperbaric chamber, and he was back in 3 weeks instead of 6 weeks, and he could have been the MVP the way he played. I mean, so what do you think about the hyperbaric stuff?
So hyperbaric also is kind of along the same lines. I just recently looked at a study out of Shanghai, China. I guess it was called the Sports Center of Shanghai, China, where they actually went and looked at 50 different studies with hyperbaric chambers and looked at all of them to see if there actually was a very bona fide benefit to it. And they had a hard time proving that it actually really helps tremendously. So again, it may help a little bit. The whole theory behind it is that you're just putting this massive blast of oxygen into your body, so your cells are getting more oxygen, they're able to heal faster. There's some talk of the cytokines, which are little proteins in your body that can cause inflammation and kind of overreact from your immune system, get flushed out better with the hyperbaric. So there's a lot of theories, and a lot of them sound pretty good, and so they may have some benefit, but we haven't proven that it does a major amount, which is why, you know, it's not mainstream really. But you know, but then again, we were talking earlier about the athletes, how they hyperperform and how they do so much better than everybody else, you know, and they're looking for that tiny bit of improvement.
Little boost.
And a little tiny boost. And does it cause a little tiny boost? It certainly may. It's not major, but with those guys, every little minor bit helps, right? So if he can get back a couple weeks earlier and play in the Super Bowl versus watching from the sidelines, it's worth his time.
Yeah, I think it's so popular now, like the umbrella of sports science. You know, we talk about that and how advanced we are now. And really we are looking, you know, around the athletes are looking for any little microscopic advantage. And you look at like all of these different things. And it's hard to prove that there's a major effect. But really, I think the athletes now are so much more attuned to their bodies and how can they make them a little bit more perfect. I heard a story recently about Michael Phelps, a swimmer, who he was talking to the Michigan football team. Like Jim Harbaugh would bring him in, and he talked about in his career the times that he was performing the best, the things that mattered, and he only talked about 3 things. And he's talked about hydration with water, cold plunges, cryotherapy, and sleep. And that's all he talked about. And so, and really, like, those things are so critical. And I think we focus a lot on that on our younger athletes now. We're bringing that to them. How important sleep is. How important hydration. So some of it is the basics. But I think we're learning more about it through sports science.
I think it's really sleep, exercise, nutrition, and I recently added a 4th, and I think it's stress. I think managing stress. I think, if people are good at those 4 things, our offices will be less filled, a little emptier. Right?
I think you're absolutely right.
I agree. How about nutraceuticals, Neal? Do you find for yourself?
So I'm not a big nutraceutical guy. I take a couple things, to be honest with you. Not anything major. Beta-alanine is one thing I take because there has been studies that show that it, because I'm a bike racer and I do a lot of aerobic activities, it has been shown on the lactic acid pathway. It provides a substrate that allows you to buffer the acid in your muscles. So your time to fatigue, it doesn't make you stronger, but your time to fatigue is a little bit longer because it allows you to buffer that lactic acid so it doesn't blow up on you as quickly. But basically, again, I think nutraceuticals are kind of a scary thing because they're not regulated by the government. And they've done lots of studies that show that they'll take nutraceuticals off the shelf and then test them. And so many of them aren't even close to what they claim to be. And it's, which gets you a little nervous. And you also have to be careful with drug testing and things like that. If you're pulling things off a GNC shelf, are you going to end up testing positive on something? So from a competitive standpoint, because I can be tested when I race, and I just want to make sure that I don't take anything that could possibly get me into trouble and get me knocked out. So.
Eric and I talk about this a lot. There's 3 things. You're absolutely right. It falls under the FDA, but it's not regulated. But there's 3 things, and it's hard for people to know. But the companies that are legitimate do third-party independent testing. So if you have nutraceuticals, that's good manufacturing process. They send it out to independent third-party testing. And that costs money, and a lot of companies don't have to do that. And you have to do your own research, and you should have what's called a certificate of analysis on the bottle, where you could scan it with your phone and look what's in it. But you're absolutely right. There was a Good Morning America show a couple years ago, and they looked at, people go, oh, I get it from the health food store, I got it from this drugstore, that drugstore, major national brands. And 9 out of 10 of them were contaminated. The contaminated word means that what's on the label is not in the bottle. But you're absolutely right, and it's absolutely critical. And I think a lot of the things that Eric said and Nick said, the things that are good for athletes, ironically, are the things that are good for longevity. So all these longevity experts that are saying, how do I live longer? Well, rest, lower your stress, basically a balanced diet. And, if you're short in some of the nutraceuticals, vitamin D, vitamin C, antioxidants, omega-3s, all the things, instead of eating this terrible trans fats, vegetable oil, margarine, those things that really compose what our cells are made of. So, what we eat is what we are. And so I think your advice is well taken. So what do you think of women wrestlers, Nick?
That's a big shift, Tom. Nutraceuticals to women wrestlers. That's a big shift.
I am all for it. I've been fortunate to, we both work with a local coach, and he was a standout, national level wrestler who's a coach of one of the local high school female wrestling teams at Easton, and it's just really, the program is amazing, and we're kind of in a hotbed of wrestling around here, like in the valley, so it's an awesome environment already, but really like how there's been kind of almost like an explosive growth around it, and the team is really like amazing, and we have and I've taken care of some of the girls. One of the girls just won a national championship. And it's just really, amazing program they have there.
Yeah, it is amazing. Who would have thought that, you'd think it wouldn't have much interest, but it's amazing. More power to them. With all the gender issues that are going on lately, and we could touch base on that maybe in the next part of the show. But even with ligament injuries and knee injuries, why do you think girls tend to have 6 times the number of ACL tears or kneecap dislocations? How can they stop that?
Well, we're trying to figure out. I mean, the numbers tell us for sure that the female athlete is at a much higher risk than the male athlete, particularly for ligament injury. So we see it in ACL tears, much more common for a high school female to have that than a high school male. And we've looked at all different kinds of things. Hormonal, they thought whether it was related to the time of the month and hormonal issues. That really hasn't panned out. The actual structural anatomy itself isn't terribly different. So I think the thing we found the most is that it's probably the kinetics of it. So sort of the physiokinetics of landing, because female athlete will tend to land a little more differently than the male athlete. So some of that is just sort of the neuromuscular firings, and so it might put them more at risk. So we've developed sort of ACL prevention programs centered around that, and then, I mean, the other thought is that there's just been an explosion in female participation in sports, really over the last 20 years, more so than there ever was before. So there's a lot more exposure as well, and then maybe there's not quite as much conditioning around the female athlete as we've focused on conditioning for the male athlete, and so maybe they come into preseason, out of shape, and that may be part of it as well.
Do you see the parents embrace that? Because it really can devastate the career. I mean, if you look at college female basketball players, it's not unusual to have 3 or 4 out of the 5 starting basketball players to have an ACL tear. And what's sort of the new approach with how you fix it arthroscopically? What graft is in vogue now? It seems to swing, and Eric and I talked on previous shows about misinformation and what's real science, but what's your go-to graft in these young athletes? How do you fix them, Neal? And
I think what real quickly on, I think so important for the parent. I think parents are getting engaged around just to know that the female athletes at higher risk, and we know that strengthening conditioning programs focused around that help them. So being around coaches are smarter about it, strength coaches, that will really prevent and help protect them. So being involved in that, and I think we're fortunate now where there's so much advancement in our technology, like what we can do arthroscopically, minimally invasive surgeries now. I don't know, what's your graft of choice now?
I think it depends on the person. Younger girls, things like that, tend to do better with their what's called an autograft, or using a graft from their own body, but you have to be careful where you take it from, because you can cause further problems if you take it from a spot that jeopardizes that particular area. With older people, I tend to use a cadaver graft, just because then you're not taking something from their body that they have to recover from, and if they're not a younger teenage person, the results tend to be about the same.
So let's take a quick break. When we come back, we'll finish up, and maybe we'll touch on a few other aspects of youth sports and even some controversial topics that are in the news today. Stay with us. Welcome back. One of the controversial topics that we see from our parents that come into the office is, number one, is football. You see this pendulum swing where you have more kids playing alternate sports, and what age should I play football? And what's my risk? When do I start strength training? And so those are tough questions, because you have to read the parents, and you have a father that played pee-wee, high school, college, and then you have a tennis player or a swimmer, and you have we're not marriage counselors, but I tell people, I go, listen, I'm not a family counselor here, but we sort of have to be sometimes. So what's your thought on strength training with kids and football and how do you deal with parents in that regard?
So it's a question we get all the time, because I live in and around sports and I love it. And football there's no way around, football is a gladiator sport, and so there's no way that you're ever going to make it 100% safe, But I always tell people, the time I spend around football, having grown up as a swimmer, but the time I spend as a doctor taking care of football players, the positives so far outweigh the negatives, the risks. So, the structure that they have, just the teamwork, what that teaches you and embeds in a kid, I think is just so powerful and important. So overwhelmingly, that's been my experience. So I would never sort of counsel a parent to steer their kid away from football if they love it, because I just think sports and athletics is just so important in their lives. And everyone always wants to know about, the strength training for kids. When can a kid start lifting, and are they going to stunt their growth? So, and I always think, some of the strength trainers I work with always tell me, there's actually good science around, weightlifting appropriately will not stunt your growth, but weightlifting inappropriately is a problem. And the biggest issue with kids is the proprioception is not there. And so, a 12 or 13-year-old in the weight room is kind of a danger to himself, mostly because of technique. And so if you have a younger child in with proper technique, it's fine. But really, if you want to get your child in lifting a little bit early, you have to make sure they're either with a coach who is watching their form, or make sure that they're not lifting heavy and that the form is perfect. But really, if you have great technique, then they're not going to hurt themselves. And a lot of times that's why body weight exercises are really good, because it's hard for them to hurt themselves even if their technique is poor.
So a theory I have is things have changed today as opposed to yesterday. And I wonder if there are more sports injuries today as there were when we were younger due to overuse injuries. In other words, when I was in high school, I was a 3-sport letterman. I played football, baseball, and I wrestled. Different sports use different body parts. Today, you see most kids, if they're a football player, it's all year round. If they're a baseball player, it's all year round. So do you see more overuse injuries today than in the past, or?
I think there are a lot of overuse injuries for the simple reason that people are involving themselves, as you alluded to, in one sport, and they're trying to push themselves harder and harder to be better in that sport. And you're pushing the same muscles and the same joints and the same ligaments over and over again. And if they don't go through the proper training and the proper strength training before they do that, and they just jump into it and go all out, they are at high risk for overuse injuries.
So as part of your guys' job as an orthopedic surgeon, as a sports surgeon, to teach these parents that maybe it's a good idea to have your kids in more than one sport? And he's not going to be a professional football player,
I think it's a good idea to be in one sport, but also, for example, I can tell you what sport is coming up just by the kids that come in. For example, before track season starts, you get all these people with overuse injuries because they don't participate in that track event, or they're not doing an all-around type thing that works those muscles, and they come in and they start running, increasing their mileage 2 or 3-fold, and find themselves with overuse injuries. So it's important not only if you're going to be on one sport and that's your deal. I don't dissuade that, but at the same time, if you're not involving yourself in different sports, so in the off season you're not just playing on your phone the whole time and then suddenly decide, okay, it's track season, let me get off my bed and start running as hard as I possibly can. So and plus from the mental aspect, from the psychiatric aspect or the psychological aspect, some of these kids, like in cycling, I see it all the time because I've been very, very involved in cycling for years, and I've taken care of professional athletes and follow it closely. And I can't tell you how many kids get push in cycling. They're training hard. They're winning national championships at 10 years old. They get to be 14 and they're done.
They burn out.
They're just totally burned out and done. So from a psychological aspect, it's very important, I think, to get the kid well-rounded. Let him be a kid, and I think we lose sight of that sometimes.
So Tom, let's flip the switch for a second. You and me, we deal with older people. I mean, with Tom and I, I don't deal with kids. We don't do joint replacements in youngsters, right? But I think it's just as important for older people to, more chronologically advanced people, I don't like to use the term older, for them to be in shape and them to exercise. So what do you tell them when it comes to exercise and health as opposed to the 16-year-old athlete?
So I think that's a very important point because we probably deal with as many older athletes as we do kids, if not more. And one of the things that studies have very well shown that after the age of 35, 40 or so, your muscle mass starts to decline at a pretty rapid rate over the course of time. So if you don't actively participate and do a sport where you're lifting weights, you're staying in shape, keeping your aerobic capacity up and those type of things, you're going to go down. And there's all this talk now in the news and things like that about, live your best life. In other words, you don't want to live from 70 to 90 in a wheelchair. You want to live it playing pickleball, and you want to live it doing those things. But with that comes a cost, and that cost is making sure you lead a good life, keep your weight down, don't get obese, sleep plenty, proper nutrition. But one of the most important things is you got to do a daily exercise program. And I don't mean going into the gym and cranking off a 500-pound bench press, but you've got to do a high rep, low impact type weight program continuously throughout your life to keep that strong and keep yourself fit. Then you won't get the overuse injuries, and then when you get older, you can enjoy those things instead of watching your friends do them while you're sidelined with disabilities.
Yeah, so something I tell my patients is you really have to focus on the different types of exercise. People don't realize, like, some people are very good at aerobic exercise, some people are very good at weightlifting, but they don't focus on balance exercises, they don't focus on flexibility exercise. I really tell them there are 4 types of exercises, and you have to focus on all 4 of them, especially as we get older, because, you know, something that we do as orthopedic surgeons is we want to prevent people from falling. And a lot of older people have issues with balance, and people don't realize, you know, things like Pilates, things like core exercises are very important for older people.
Well, exactly. If you're over 70 and you fall and you break your hip, your chances of dying within the next year are what, 30%?
40, close to 40, like 36% mortality.
Yeah. So it's and that's really scary. And all that takes is just work on your balance. Do some balance exercises. I mean, they're very easy to find, and they're actually kind of fun to do. I do them all the time because it helps me with my bike racing and stuff, and, you know, being able to balance and stay in that right position.
So I have two pieces of advice when patients come in, because most of them start exercising because they're overweight, and they go, you know, I want to go to the gym and lose weight. And I said, really, you know, if you have 2 choices, exercise more or eat better, let's just eat better. Because in the big picture, your nutrition is so much more important in your weight control than it is exercise. It's really probably an 80-20 ratio. I mean, exercise is important, but the nutrition is so much more important. And as you said, they just sort of start and they just overdo it. You know, it's almost like, I remember at one time when I was doing a lot of sports medicine, the most dangerous sport for injuries was not what you would expect. It was girls cross country, because they had the highest number of injuries, for your point, because they got up and they just started running and running. It wasn't serious, but it was all overuse, but by volume and numbers. And it's the same thing with older people. They go to the gym, and there's like this great rule that for your health, you should work out, you know, 30 minutes 3 times a week. Just know that anything you're doing more than 30 minutes 3 times a week is not for your health. It's for some other reason. It's for a sport, it's for something else. But for your health, that's what you need. So you don't have to go crazy. You know, you don't have to go, you know, we do a knee replacement. They come in, they have a swollen knee. And you say, well, what's going on? They go, nothing, I'm just going to the gym. Well, how often? Well, I go every day. You know, they're going to the gym 5-6 days a week, and they're overdoing. I had a patient this last week, Eric, and for a year and a half, he was a national tennis player. He had both knees done somewhere else. I did a revision. He's still competing at a national level, and I couldn't get rid of the swelling. You know what got rid of the swelling? His retinal detachment.
I hear you on this, but this is one of those things we disagree on. I think exercise and nutrition are 2 links in a chain.
Yeah.
I think one without the other, you're not going to optimize things. I think when you optimize your exercise, you're right, you can overdo it. But 30 minutes, 5 days, at least 5 days a week, you're supposed to get 150 minutes a week of some sort of exercise. That's what I talk about, balancing the exercises, you know, with the 4 different types. Don't do the same thing for 5 days a week, but do it. And I think if you exercise, they show that you're going to increase your metabolism. So you're going to help the other side when it comes to eating also. So I'm kind of a proponent of doing both.
The other point to that is let's talk about VO2 max. You know, if you maintain your VO2 max in an older person by doing you don't have to go crazy, but walking or doing aerobic exercise to keep your VO2 max, and that's just a measure of how much oxygen your body can process over the course of time. So if you have a very low VO2 max, meaning that you get tired out very quickly, you're going to fall more, you're going to have more problems. So I would agree with you that I think nutrition is extremely important, but also just as important as exercise. If you're not doing both, then you're gonna get in trouble.
How many 85-year-old obese, out of shape patients do you see that are 85 or 90? They're not there because they're dead. Some of my 85 and 90-year-olds look better than my 60-year-olds. And I always say to them every day, what do you do? What's different? Well, I'm active. I eat right. I have a scotch a day or a brandy a day, whatever, but they don't overdo it. And they get proper sleep. They're happy. They're happy with their relationships. And that's the secret sauce. I mean, the secret sauce is those 4 things we mentioned: sleep, exercise, nutrition, and managing stress. That's really what I think.
They don't stop.
As a joint surgeon, that's my.
No, you're entirely right.
Yeah, I think you're spot on. I think exercise, there's so many different ways to exercise. I always talk to patients, because some patients just hate the thought of going to a gym and they dread it. So they're like, I don't want to exercise. And you're like, oh, there's so many ways to exercise. You know, whatever it is, you just got to keep moving. And I mean,
gardening is exercise.
Yeah, exactly. And just whatever makes you happy. Because if you don't,
Is darts exercise?
I would maybe to some
Only if you
people.
drink a pint of beer in the middle.
Only for drinking beer is darts exercise.
I'm never sure if darts is exercise.
But I always see, I mean, I see so many of the injuries I'll see in like someone who just jumped into sports, because we'll see the weekend warrior who jumps into it. So it is, I don't think people do have appreciation for the athletes they see, like that couch to 5K. You know, if you see it online, it'll be like, oh, you can do this in 6 weeks. And it's like, no, you can do this in a year and a half.
Right, exactly.
Like if you haven't been a runner, because like if you look at someone like Neal, who's been biking his whole life, to get there, you know, it doesn't happen in 6 weeks or 6 months. I mean, really, it's years, you know.
So those tree trunks that he has for legs didn't happen last night, right?
Yeah, it's just the habits, you know. So
You know what's great is that, you know, we talked about our education. You went to the greatest schools, the greatest fellowships. But you know what? The most important aspect of what you give to your patients is your experience.
100%,
The amount of years
100%.
that are sitting at this panel right now is absolutely phenomenal. You walk out of your fellowship and, you know, you really only know what you were taught there. But it's really in that room, on that field, with those athletes, what you've learned and your experience. That's really what you're parlaying to the people. So, I mean, the skill set that sits here and the experience and what you guys bring to this part of Pennsylvania, there's no better skill set in the country. There's equal skill sets, but I am so proud of what we offer here. And I want to thank you guys for coming, participating, Eric for being the co-host. We could probably have a mini series on this. But anyway, folks, thanks for joining us, and hopefully we'll see you next time.